You're watching HuffPost Live. I'm Alicia Menendez. It turns out the Affordable Care Act, well, it might not be so affordable after all. That's according to the executives of fast food chains like Popeyes and Wendy's and the workers they employ. Obamacare requires employers with 50 or more employees to offer their workers a benefit plan that costs less than 9.5% of their income, or they face a penalty. Employees have the choice of purchasing the insurance or paying a $95 fine, an option that Popeyes president Ralph Bauer says is more financially feasible for his employees. Is he right? We're joined over the phone now by Congressman Jim McDermott, who represents Washington's 7th Congressional District and played a huge role in the fight for Obamacare. And in our hangout, we have Elise Gould. She's the Director of Health Policy Research at the Economic Policy Institute, Jeffrey Young, HuffPost healthcare reporter, and Teo Reyes. He's the National Program Director of Restaurant Opportunity Center United. It is great to see everyone. I want to read you this statement that we got from Popeyes. This is a statement provided to the Huffington Post. Given the 2014 penalty to the individual if they choose not to participate in the plan is $95, we anticipate that many will choose to pay this lower cost penalty than the $1,200 cost of the minimum health care plan. Further, we believe some team members may choose to work part-time as a way to avoid the individual mandate penalty. Congressman, what would you say to the people who run Popeyes, the people who run Wendy's?
Well, first of all, I would say, do you care about your employees? Because that kind of a memo sounds like all they're worried about is the bottom line of Popeye. And if you don't care about your employees and whether they have good health care or not, you simply, I have a hard time dealing with you, particularly when you're dealing with people in the food industry. Do you want people to have health care who, when they feel sick, want to go and have the ability to go to the doctor, or do you want them to come to work and potentially infect the people eating their food? I mean, you've got to look at this beyond simply the bottom line about how much it costs Popeye to provide health insurance. I think that they are going to be surprised by how this ultimately works out. If the effort is simply to offload the costs onto the federal government, the Congress will become aware of that, and there's evidence that Popeye's not alone. I mean, I'm receiving calls from companies and labor negotiations all over the country about ways in which employers are now looking for ways to offload their employees and force them into the exchange system, and the company will get by doing offering something that's out of the reach of their people, and then they can say it's unaffordable, therefore go into the exchange. This is going to be chaotic, because I think that what's been lost here is a sense of the common good. If Popeyes really cared about the common good, cared about the people who worked for them, they wouldn't be writing that kind of memo and saying, well, here's what we planned out economically, how we're going to get rid of some costs. And we don't care what it does to our employees. Let them try and live on 29 hours a month or a week. At 30 hours a week, then we have to consider them a full-time employee. I mean, they're jamming people struggling to keep their head above water.
Yeah, absolutely. And yet, Elise, even though I agree with the congressman's assessment of the morality of the situation, I'm curious to hear from you. Do you think that Popeye's assessment is right? Do you think when you're talking about hourly employees that they are more willing, more able to pay the penalty than they are to pay into the insurance plan that is offered by their employer?
Well, when I think about these low-wage workers, and I think about whether or not they're going to be able to afford coverage, one of the questions is whether or not they're buying coverage already. And if they're already buying coverage through the employer market, if the employer is kicking in enough of that premium such that the employees can actually pay, it's affordable for them to pay for it, health reform isn't going to change anything for them right away. They're going to still keep on buying into that insurance plan, and they're not going to change what they're doing. To the extent that health reform makes it more affordable, you may see more workers actually able to afford buying insurance through the employer.
I want to bring up some comments coming in from our community. Refrain we've heard before. This is from Justice Holmes, who says, single payer, it was and it is the solution. And Diego saying, I agree, that was the solution to all of these talking points. Hopefully the exchanges will be a somewhat effective Band-Aid, but if states drop this, we are screwed. Congressman, hindsight's 2020. You made a big push for a public option. That was off the table. Do you regret that?
Regret having pushed or having failed?
The latter.
I don't regret pushing because I ultimately think that a public option is going to happen. We have one in the state of Washington. It's called the Basic Health Plan, and the administration has been dragging their feet in writing the regulations because they're trying to force people into the exchanges without a public option. I really think that we will ultimately come to that because of cost. I think that I don't think this plan this wasn't brought down off the mountain by Moses. This isn't in 10 tablets. This is something that we wrote in Congress, and we will change it, and we're going to keep changing it. And I think it's going to move closer and closer toward one where there is a public option because in the end, that's the only way you can take the profit that the insurance companies and the drug companies, the device makers are taking out of the system now.
Yes.
We have to cut into those profits. The fact that we still have prices that cannot be negotiated suggests to me that there's a lot of money to be saved in a public option.
Yeah, absolutely. Jeffrey, talk to me a little bit about this because we have all different types of mechanisms. I mean, we have an expansion of Medicaid going on. We do have these exchanges. I think so often if you're tuning into this conversation, you just get dizzy listening to these different terms.
Well, first I want to go back to the quote that you showed everyone from the Popeyes executive that was in the story Monica Brucey wrote for us last week. He's wrong about one important fact.
Elise, do me a favor and stop typing. Sorry, we're picking up the sound on that. Go ahead.
He's wrong about one important fact, and that was actually corrected in the story, which is that the individual mandate to obtain some kind of health care under this law has nothing to do with whether you work full-time, part-time, or not at all. So that's just factually wrong. So an employee wouldn't be able to cut their own hours to avoid anything. The second thing, I think this is really important to emphasize. When we talk about people who work in a fast food place or a chain restaurant or a retail store, places like that, they are very, very likely to not have any insurance right now for a variety of reasons, but starting with the fact that they can't afford it. They don't make enough money to buy insurance, even if their employer offers them something. Also, a lot of these kinds of jobs will offer fairly cheap insurance that doesn't really cover anything. This was the status quo that this healthcare law was trying to address. If you see the law primarily or largely as a means of extending health insurance coverage to more people, these are the people that it's trying to reach.
Yeah.
So it's easy to forget that when you talk about the wrinkles from the implementation. And by the way, we're mostly hearing that from the executives at these companies who have health insurance now. So what's really going to happen to people who work at, say, a Popeyes or a Wendy's or an Olive Garden or what have you, is their employer has to make a choice. They can either start providing these people with health benefits that are affordable and comprehensive the way the law defines it, or they cannot do that, and those people can go find coverage elsewhere through Medicaid, which is more or less free if your income's low enough, or on these exchanges where, again, if you're working an hourly wage job in a retail store or a chain restaurant, you're probably not earning that much, and therefore you'd qualify for decent subsidies. If you do that, then your employer has to kick in a little bit of money per person to make up for the fact that you're sort of on the government's dime. So I just want to, I said all of that to build up to a main point, which is that we cannot like these mandates, and employers cannot like the money it costs them, and hourly workers cannot like the possibility that they may see their time at work cut to fewer than 30 hours, so their employer doesn't have to deal with any of this. But it's supposed to give them health benefits, and in that sense, there's no reason that I can see that it wouldn't do that unless the whole law collapses.
Yeah, absolutely. Congressman, I want to come to you because I know that we're going to have to let you go in a moment. You talked earlier about the possibility of coming back, amending this legislation, rewriting this legislation. What are some of the changes that we can expect when it comes to us revisiting Obamacare?
Well, I think most of them will be adjustments in the basic format. Hopefully, we are going to get we're going to get a public option on the table, and people are going to have to look at the economics of that. But some of the rest of it will be adjusting the amount of subsidies to small business and the amount of subsidies to individuals, and trying to figure out how to make it possible for people to have health security. We are the only industrialized democracy in the world that doesn't give our people the security of knowing that if they're sick, they can be taken care of and they're not going to be bankrupted. And I think that we will keep adjusting it. No law that you write is perfect the first time you write it. I've made amendments again and again and again and again in my life to things that I wrote originally thinking they were going to work, then finding out, well, that didn't quite work. We've got to make it over here. And I really think that's what's going to go on in 2014. You're going to see the Congress working hard to make this thing work. And I even think the Republicans are going to begin to see that the folks back home got a real problem and they want some help. And I think they're going to expect the Congress to do something about it.
All right, Congressman McDermott, I want to thank you so much for taking the time to join us. To the rest of our